Good morning, everyone. Our topic for today is care of clients in certain emergency situations, and welcome to Unit 7, the final unit of our subject NCM 118. So what's included in this topic are the following subtopics: alcohol use disorder, substance abuse, intimate partner violence or IVP, sexual assault, agents of bioterrorism, anthrax, smallpox, botulism, and COVID-19 will be discussed separately. I don't want to include it in bioterrorism because we are not yet in the level that we consider COVID-19 as part of the bioterrorism. And the last portion are the acute common mental health problems, acute psychosis, and post-traumatic stress disorder. Both of these will not be discussed because I believe this has been discussed in your psychiatric and mental health nursing, so there's no need to repeat them. The same interventions in the emergency department. The first topic that we'll be discussing is alcohol use disorder. So the excessive use of alcohol is a significant public health issue in the United States. Ethanol or ethyl alcohol is an intoxicating substance or ingredient in beer, wine, and liquor. About 17 million adults aged 18 and older are currently have an alcohol use disorder in the United States. So alcohol is the widely used and abused depressant drug, and its effect varies from person to person. Alcohol use disorder. So there are 3 levels of drinking alcohol. So the first one is a moderate alcohol consumption, binge drinking, and heavy use. I believe that you already heard the 3 levels. So these 3 levels have different descriptions. So for moderate alcohol consumption, definition of which is for women up to 1 drink per day. So that's a moderate alcohol consumption. So when you say I'm a moderate drinker, so meaning to say you drink, if you're a woman, you drink one shot per day. For men, it is up to 2 drinks per day. So that's moderate alcohol consumption. So when they ask me, Dominic, do you drink? Most probably I will say no, or I will say occasional. Next level of drinking alcohol is binge drinking. So when you hear the word I'm a binge drinker, it means to say that the pattern of drinking that brings blood concentration, alcohol concentration level, or BAC, up to 0.08 grams per DL. For women, it is after drinking 4 shots in 2 hours. So that's a lot, right? And for men, after 5 drinks in 2 hours. So that's binge drinking. The last one is heavy use. From the term heavy, so this is like binge drinking on 5 or more days in the past month. So mga na gitawag og heavy use. So moderate alcohol consumption, binge drinking, and heavy use. So remember these terms because when you do your assessment, you'll use these terms as this person is a moderate drinker consuming of about. Usually when I assess patients with alcohol intoxication, I usually ask them how many glass do you drink per day or the entire week. So a lot of people will say I'm an occasional drinker, and you'll ask how much, like 12 cans per day. So 12 cans per day, asa mo na i-classify, no? Okay, now there are short-term and long-term effects of alcohol. Short-term effects of alcohol is that they cause injuries and risky behaviors. So drunk driving. So in Canada, drinking alcohol, no matter how low, is not allowed. So you're not allowed to drive and drink alcohol. So makitaan ka, dakpon ka, in suspension as imuhang license. Inappropriate sexual behavior, no? Magdadon sa boarding house kay mag-inom nya. Paimnon dayon nya mato magbiga-biga din sila dito, no? So And sometimes mga pasyente nga na ay alcohol intoxication kay na sila explicit sexual kuan kanang mga words nila na impaired judgment mo nang di pwede mo drive kay ni drive mo makita lang nimo nga anong ang mga pusti ni lihok man, no? Coordination and reflexes, slurred speech, and memory problems and death, no? Anong mamatay man because of intoxication, withdrawal symptoms. So memory problems. So this is the reason why when I was in college, I don't drink alcohol. Inom ginagmay pero as much as possible, I don't want to drink because of memory problems. My teacher in anatomy and physiology told us that alcohol shrinks or kills the brain cells. So, dili maayo ang alcohol, especially kung mo take na sa board exams. No, ayaw sa inom. Yan na mag-inom, inighuman na sa inyong NCLEX. No? Long-term effect, arrhythmia, stroke, hypertension, cirrhosis and fibrosis of the liver, mouth, throat, liver, and breast cancer. My dad died of liver cancer because of alcoholism. So good check, inom at age 11, mo na nagka-liver cancer siya. And it was just very sad because he got liver cancer in 1989. Nga wala pang technology for liver transplant. Naman gani kay mahal. So, wala mi ka-afford. My dad died because of that. No? Hypertension. So, yung pasyente nga maabot sa emergency nga na intoxicated with alcohol, taas na sila of blood pressure, no? Sa Canada, kung makuan ka, mag-alcohol intoxication ka, dadon ka sa emergency, ato di kay butang sa acute, no? Kay monitoron ang imuhang seizure, yun na kay seizure precaution, imong blood pressure, imuhang vitamin B12, no? So tagaan ka supplementation. Pero sa Pilipinas kay dumatay na kay butang naman sa kilid-kilid, no? Butang sa kilid-kilid, sagdaan na niya ay matay. So, you learn that in anatomy and physiology nga patulgon na matulgra ka, then ang body mo sente mo kuan ra mo metabolize sa alcohol. Sleeping ra, sleep it off, no? So the treatment for AUD or alcohol use disorder is to provide usually healthcare providers collaborate with the person collaborate with the patient kay for a combination of treatment like medications, mutual support group, and or behavior therapies. In here, it can tag clinic or support group for patients with AUD, no? And behavioral therapy. So cognitive behavioral therapy, mga yung mga also nga mga therapies for alcoholism, AA groups, AAA groups, Alcohol Anonymous, sila diri, no? Medications kay these are the medications for alcohol use disorder. So acomprosate Campral, this is used to reduce symptoms of protracted withdrawal cravings. Naltrexone. So naltrexone, I think you've heard about this. This is a what they call this? Reverse opioid side effect na respiratory depression. Naltrexone, tulo na sila kabuok, puros N na ko na. One of which is naltrexone, and in this case, naltrexone is used to reduce the cravings of alcohol. Disulfiram antabuse changes the body, changes how the body metabolizes alcohol. So, ang resulta, it results in an unpleasant reaction like flushing, muwa sila, nausea, or vomiting if a person takes medication and then consumes alcohol. Mana initik nila disulfiram or antabuse, bawal mag-gargle alcohol, what do you call this? Ang gargle nga na alcohol. Kay kung mag-gargle sila, musuka din sila. Extreme vomiting gid or using products with alcohol. Mana careful mo ninyo, nurse intervention So, other medications, kung nag-intoxication ng pasyente, abot niya sa ER, no, sa mong buhaton, amo dayon siyang kuanan kanang tagaan o fluid electrolyte. Kung nag-dehydration ng pasyente, taas ang blood pressure, control dayon siya, o mogamit mi og siwa. So I'll discuss to you sa natay topic ng substance abuse, I'll discuss to you what SIWA is. So mo important kay nga tool namo ikaw man mag-assessment sa pasyente. SIWA dayon assess nimo ang kanang basta I will discuss later on. Hindi siya nga tool unya na aday kay kanang mura og kanang guide kung pila nga amount of dilantin ang pwede nimo ihatag sa pasyente. So it is very important nga kay balo mo gamit ang nurse o SIWA for alcoholic patient kay ang kuan nato kung mag-intoxication ang pasyente ang ato i-try to prevent kay kuan man seizure. So mo na kuyaw. Pero sa Pilipinas no kay mga pasyente butang na sa kilid sa dano ni matugro sila nya wala lang dinhi kay kuan na sila acute cases na kung inana pinangga kay na sila din sa ER butangan gyud na sila bed mga alcohol intoxicated nga patients. So, next is substance abuse. Isiperte na ako sa alcohol AUD kay different ang substance abuse. Although AUD is included in the substance abuse kay substance man ang alcohol. So, WHO definition of AUD is that this is a harmful or hazardous proactive substances including alcohol and illicit drugs. So, substance use disorder are complex diseases of the brain characterized by craving, seeking, and using substance regardless of the consequence. So, substance abuse mo ni ang katong previous nga administration sa Philippines si Duterte mo ni ilang focus nga kanang substance abuse, no? So, result into katong tukhang inana o mga katong mga interventions nila no mga rehab nila. So, let's try to see a different perspective of kaning substance abuse. So, unsa gani siyang substance other than kanang kuan siya, kanang so mga myths behind aning kuan substance abuse. So, continuous substance use results in actual change in the brain structure and function. Substance use disorder are chronic. So, kuan sila long term dili kay gahapon ra and relapsing like balik and the magnitude of effects on people continue to rise. So of particular concern is that of opioid overdose. No, this opioid overdose epidemic continues to worsen in the United States, Canada, and the Philippines. So drug overdose is driven by opioid addiction. It's the leading cause of accidental death in the United States. Substance abusers at a high risk of suicide, homicide, and overdose. Sa Philippines po, mapod na siyang problem daghan ang gamit o kuan overdose. For some reason, I don't know why people use this. Hindi ko mainom. I mean, minom ko kanang dili jud siya heavy, nga kanang magilak-hilak, magdrama, no? Magmaoy, no? So, tabako. For me, lahi good siya. Makatimaw og tabako, makatimaw og alcohol. Mura kog mamatay. No, so I don't know. Ang uban yung English lang iuhaw jud ko red horse. No, so substance abuse also includes your alcohol, pero most nga substance nga gi-abuse kay opioid. So substance abuse, how to assess a person who have a problem in substance abuse. So you ask what is the history of patient's past use of this substance, or what did she just take before coming to ED. So sometimes, not sometimes, every time nga nakoy pasyente nga ingon ani mga substance abuse, I always ask them, do you use recreational drug? No? So ang pattern sa inyong question is matter of fact, ayaw nang maghisitan ka og ask a question. Did it so good? Do you use recreational drugs? Not drugs, no? Kaya pati paminaw, recreational drugs, and they will tell you, no? And assure the patient nga di mo panabi sa law enforcement. One time, I asked a patient, do you use recreational drug? And the patient said, will you tell this to the police? I always say, I am not the law enforcement. I am not the police. So the assessment that I have remains in the medical team, not anywhere else. One time nag-assess ko pasyente nga suspected for substance abuse. Ang police ni stand in between me, nag-andar din ng iyang body cam, you turn on din yun. And I said, no, you can't capture my assessments. So turn off na ilahang kuan, ilahang body count. For alcohol, last amount consumed the last 24 hours and the time, the amount of the last drink. So motana ka ana. Next is there any history of blackouts or seizures related to withdrawal? That's very important because if a patient has a seizure, later on, hindi na ka magamit si mong siwa. So for drugs, what is the amount, timing, and route of last use? Usually IV or inhalation. Has the patient been treated for substance abuse previously? Is there any history of withdrawal symptoms or overdose? So let's talk about marijuana in the Philippines. Marijuana is not allowed, no? Dili siya kuan siya kanang illegal siya, no? Nagitoy issue nga ang anak sa Department of Justice nga head kay inadakpan nga nagput og marijuana in Malaysia po. No, marijuana is kanang not allowed, no, death penalty na sa Malaysia. When I was in Malaysia a long time ago, like in 2012, I went to Malaysia and then I had this guy in the bus. Tupad na ako, buhok siya og marijuana. Sige siya bag-id sa ako ang dini kay kuan biya mo shoulder biya ng kuan ka ng tawagan na bus. So pag naa sila yung mura og machine nga mo detect og marijuana use, nakuanan sa machine, detikan sa machine nga ay marijuana nga ako ang bukton dinhi. So ila kong gusto ng machine, gipautan ako, are you a user? Kung ano, I'm not, I don't use anything. Human kay ang nahitabo kay gidetain ko kadiyot kay investigate tanaw ako mga stuff. Then later on ko anda ito katudungan dito sa lalaki nga ko ano. So careful mo aning marijuana. In Canada, cannabis is allowed, no, so everyone can use. Wala ako nakitaan nga kasagaran akong pasyente nga maabot sa ER kuan na asla history of substance abuse, marijuana abuse. Yung mo nilang last intake marijuana nya, nag-hallucinate sila, kuan sila kanang manic nag episode of psychosis, manic episodes po, psychosis dito sa kuan, no. Wala po ko nasuway nga nag-inom og marijuana inabot sa ear kay itong siya na bright, no, positive effects ba nga na-admit kay nasubraan sa bright, no, wala. Sigaran din nga marijuana nagland sa emergency department kina yung mga problem, psychosis na acute psychosis attack na. Has the patient been treated for substance abuse previously? So muna yung question because in Canada natay mga clinics nga mohatag og small amount of mohatag og small amount of opioids para dili mag withdrawal ang pasyente. No, na siya ko na pag first mo mohatag sila og kuan kanang inana, mohatag sila na sa Toronto. Is there any family history of drug or alcohol abuse or problems? Does the patient have any coexisting physical conditions? What is the patient's current medical status? No, usually na sila diabetes, na sila kidney failure, is there any history of violence towards self or others? No, do you plan to harm yourself or others? Part na sa imong question, psychiatric na siyang assessment. Are there any thoughts or plans of self-harm? No, kung nagsabot og self-harm pasyente, you say suicide. No, direct and matter-of-fact question, do you have plans to commit suicide here in the hospital where you're here? Imagine yung pangutana. No? So treatment, immediate medical treatment of withdrawal for overdose symptoms should be undertaken to avert any life-threatening conditions, no, or problems like seizure, no, pwede matay ang pasyente ana. So are there any physical complications related to drug abuse like AIDS? Magka-AIDS mo sila because sharing of needles, right? Abscess or any hepatitis, and a focus of treatment should be on appropriate follow-up. So important kaayo after they're being discharged in the hospital, they're being followed by social work in the community. Kaya nga no, balik gyapon na sila sa kuan sa ER kaya nag-substance, nag-intoxication gyapon, no. So this is what I mentioned moments ago. This is what we call the clinical withdrawal assessment for alcohol or SIWA, no? So these are the symptoms. So na siya scoring, no? So ang order na sa doktor na sa PRN medications. So mag-order siya og, for example, 8 to 15 siwa score, mao ninyong ihatag. 15 and above, mao ninyong ihatag. Naa siya order, no? Specific parameters. Mo siya sliding scale sa diabetes. So kani mo ni inyong pangutana sa pasyente, nausea or vomiting, no? Tanawon yung pasyente na ba siya nausea or vomiting, no? So ang uban ani pwede nimo pangutana, ang uban kay observations. Nganong di ilikayan man nimo pangutana, na nagsuka ka, no? Nga pasyente no kay denial man ang ilang first nga defense mechanism. So tanawon nimo kung nalipong kung nausea tana ka, are you nauseous? Ana vomiting dayon, no? Tanawon nimo kung nag-vomiting ba. Kung wala, 0. Kung naa, so imong i-rate, no? Mild ba, moderate, so 1 to 7. Tremors, so na kaya na siya assess imong panahon ng pasyente. Can you hold your hand like that? No? So ilibot lang kamot, kita niya ang ana, daw kay nag-score. Next is the paroxysmal sweats. So tanawon ng pasyente kung gipaningot ba, no? So anxiety. So I'm not anymore. Do you feel anxious? Do you feel agitated? Second question, no? Muna yung pangutana. So usually, musulti sila, yeah, a little bit, no? Yeah, pangutana ka, do you feel, for tactile disturbances, pangutana din ka, do you feel itchy? Itchy? Or you see the patient is itching? So, dako kayo nag-score. So, imuni ko from 0 to 7, no? Next one is auditory hallucinations. No? Auditory hallucination ng pasyente. No? So, sa na nyo pag-assess, mingon ka nga, does the noise hurts your ears? No? Yeah, kung so digay, yes. So, what, tanong na ka nga, do you hear something other than me talking to you right now? So, yung yeah, some, like, there's a humming, blah, blah, blah. Yeah. Wow. Wow. Positive. Wow. Next is visual disturbances. Mingon ka nga, do you feel that, imong pangutana ng pasyente nga, do you see that this hallway is narrow? Yeah, dili good hallway wall gud ni imong gikuan. Yeah, it's very narrow. Yeah, it's a wall, no? Or mingon ka, do you see someone other than me today in front of you? Yeah, the kid. So kana na hallucination na ng pasyente, no? Next is headache. Mutana ka, do you have a headache right now? Is your head hurting? Do you have pwede sa na siya kuan, lightheadedness. Lightheadedness. I feel like something's wrong with me. Something wrong with my head. Next is orientation or clouding of sensorium. So, may pag-assess 0 to 4 ang scoring system. May ka nga, can you tell me, for orientation purposes, can you tell me your first name and last name? Masugod yung ka for orientation purposes kay mga pasyente, mga tawa na sila, mga tawa ka, can you tell me your first name? May lang, what? Karon nakamutan na sa akong first name ug last name niya. Di feel nga katawanan na siyang assessment. Mga na ka. So, itong for orientation purposes, can you tell me your first name and last name? So, alert oriented times 4. So, oriented in person, can you tell me your first name and last name? Oriented in time, can you tell me the date for today? Oriented in place, mingon ka nga, do you know where you are right now? And situation, mingon ka nga, do you know why you are here? Answer ang pasyente ana, mingon ka, alert oriented times 4. 0. Kung kuan ra duha, alert oriented times 2. Alert oriented times 1. Positive na 4. Di wag i-check kayo sa inyong galingon. So, kung taas, kung nasa parameters sa doktor, mabutang man parameters, no? For 8 to 15, 15 and above, mabutang na sila. Pila ka dailanti ng ihatag. So, more na yung ihatag. So, it's important nga kuan, muhatag dayon ka, kay kung dili ka muhatag, kuan yung pasyente mag-withdrawal symptom. Lisod na tabangon. So ako sensitive kay kuani, mga tunay ko pasyente na history of substance abuse or alcohol abuse, diretso na dayon ko. Mingon diretso na dayon ko pangutana, are you nauseous? Did you just vomited? Muna akong pangutana. Can you hold your hands like that? Ano na ko, okay? Tanaw ko sa panit kung nag-paroxysmal sweats ba siya or nag-itchy ba siya, no? So mingon ko nga, do you feel anxious, agitated, something like that? No? Hindi ko mapahalata ang nagsiwa ko kaya maroon yung pasyente. And then tactile disturbances, no? Nangout ba? and auditory services, visual, iba naman pag-assess headache, and orientation. Sometimes akong pa-count to ng pasyente o 0 to 10, no? In reverse, 8, 9, 10, 11, 12. So there, in that way, you know nga nag-function pa ang brain. Don't ignore your CO scoring. Be familiar. Kaya kung hindi mo na-ignore, ano sa yung pasyente? Ano yung pasyente? Magkurog-kurog yung pasyente, no? So, careful mo, anak. Now, let's check number 1. What is CY used for? A, used to assess for alcohol withdrawal. B, to assess for level of consciousness. C, to assess for dementia. And D, to assess for confusion. So, intimate partner violence or IPV, no? I don't know kung sa gamit nga term sa Philippines, but mo siya gamit sa term sa US and Canada. So, definition of IPV includes physical violence, sexual violence, and psychological aggression by a current or former inmate partner. So, it's a current or former intimate partner. No, it's either boyfriend, wife, husband, wife, or anyone nga imuhang kuan, current or ex. So, an intimate partner is defined by, so who is an intimate partner? Is a person with whom one has a close personal relationship that may be characterized by the partner's emotional connectedness, regular contact, ongoing physical contact, and sexual behavior, identity as a couple, and familiarity and knowledge about each other's lives. So, kinahanglan na amoy relationship, no? Either ongoing or past relationship. So, mo na siya gitawag intimate partner violence or IPV. So, the incidence of IPV begins in adolescence. Kanang high school pa ta, nya, mo nang mga classmate ninyo nga manag-uyan niya, mag-away-away sa luyo sa eskwelahan niya, magkuanay din sa dayon, magkanang sinagitay, dramatic, overly dramatic, diha magsugod ang IPV, no? And then, adults in social and cultural groups among lesbian and gay, heterosexual, and transgender couples, and in married relationships. So it happens in a wide variety of situations. Whether you're straight or not, whether you're part of the LGBT groups, IPV happens, and it starts in adolescence. So, ethnic group at risk, multiracial women, 58%, Native American, Alaska Native women, 48%, Black women, 45%. And it depends on, IPV is also dependent on culture, your way of living. Kaya may mga cultural group that believes that women are lower than men, no? Di na natin i-mention ang mga kanang ethnic groups, but naakyod na sila kwan. Kasi mga religious people with religious background, no, nga they think, nga ilang religion thinks that women are kanang lesser, no, nga dili patingugon ang mga women. So naasa na siya, no, and it plays a role. So kuan mo na kanang be aware of that. Now let's check when does IPV begin? A, childhood, B, infancy, C, adulthood, and D, adolescence. Risk factors for IPV. Highest risk are the young and married women who experience an unplanned pregnancy. One of the highest factor. Women who experience abuse in childhood are more than twice as likely to experience IPV during their lifetime. So, mauna siya according ni Sweet and Foley. Okay, experience good abuse in childhood, mauna likely to experience IPV during the lifetime. So, mauna ang importante kay na mga bata are not abused, no? So, nakanugbi ako sa news nga ang Philippines kina as hotspot sa child abuse, no, child sexual abuse, no. Other factors are history of IPV, pagka batan mo nimo nagpaay na mo sa imong uyab kay gusto mo mag-drama, maraming Korean drama. Young age, low self-esteem, low academic achievement, no. Ug parents pod of low, if your parents have a low academic achievement, mo pod na alcohol use and abuse, and parents with high school education. No, mo na siya kay ang education is a key man good in the awareness kana about sa mga abuse inana. So kinahanglan mo na kamo graduate mo. Yung mga anak aron ni better life ang yung mga anak, no? But it's not always the case though. Na ko yung nahibawan ng mga highly educated person nga kung mag-away kay grabe. Cycle of violence in an abusive relationship. First is tension building, abusive incident, and honeymoon phase. Tulo lang. No, naiuban nga cycle nga daghan ra kaayo pero kani kitulo lang. So first is the tension building phase. So this is the last 4 hours, days, or months. No, so victim feels as if he or she is walking on eggshell trying to please the abuser to avoid abuse, no? Tubig, kita mo ng drama sa malala mo kayo sa akin. Like tubig, no? Mag-careful lang. Tiptoe sila kay kuan. Masig makulatahan sila ang bana. And verbal abuse and threats may occur. Kulatahon tigaron na sila, no? So mo na siya tension building phase. No? Magbantay ang affected ang victim kay magbantay gyud nga di pa kasala kay patay ko ani, no? Excuse me. So next is the abusive incident. So paghatag nagdahunuhay tubig na hatag na yaban, no? Pao ni pa hindi ka maghinay, no? Physical, emotional, and or sexual violence, of course, no? Kagabi mga blit din si mister niya pagkablit kay mo dili ka masud awan ako latahon na yun ka, no? Abusive incident. And then next one is the honeymoon phase. So the honeymoon phase, after ka na bunog nung na nakagpanda, abuser may express remorse or shame for his or her behavior. No, makes promises that it will never happen again. Dinagli mo usab day, no? Promise, purchase gifts, bata ni mga kwintas, no? Or balot, balot. I'm just joking. Affectionate, so will become a victim. What do you call this? Abuser will become affectionate, so victim will not leave the relationship. So and eventually this stage ends and cycle starts again. No, so na siya. Balik sa tension building, abusive incident, then honeymoon phase. No, di lang ta malayo no mga example akong ate, no, is in this cycle building niya among gitambagan nga mauna get out of that situation. Okay, grabe kay sila kung magdrama kay mura sila Korean drama, no? Grabe kay marag drama sa ABS-CBN nga pang world class kay kung magsinagpaay. But ginahan man akong kuan ate, hindi siya ginahan mo pahawa sa relationship for some reason katong nga time I don't know. So ang gibot sa atin ibalhin sila puyo, ibalhin sila isla away from us aron mi makita sa ilahang drama. So why women stay? Women stay because victim believe that if they just love the abuser enough, things will change. No? Kuwangan tra gugma, no? Tagahapan lang more gugma. So basta kong ate, no? Tagahapan niya og gugma. And then unable to financially support themselves, no? Matay sila, ma-homeless sila kung biyaan sila. Cultural factors, no? My sister would always tell me, I don't want a broken family. Charot sa kaya ate. I don't want a broken family. Yeah. Ang iyang husband kay is nothing. I mean, wala ka na wa ko nakita. Dili gwapo. Dili kuan. I don't know kung anong akong ate ni stay. And afraid of retaliation. Mo ni ang kadlukan. Kadlukon man siya. Pati yun tika. Naanaw siya sa iyang husband. Yeah. Ihaman ang decision. No? So, we wanted to get her out of the situation, but di man, mora man kahapon. Isuwayan mo ito na mo. Balik man kahapon. I don't know kung sa'yo na siyang bana, no? Kung sa'yo na siya man kukibaw, no? So, this ko interested. Treatment of batterers, legal interventions. Person could be arrested or persecuted, no? And the treatment is focused on prevention and decreased recidivism. So, kanang balik-balik, no? Role of the emergency nurse. So, screening, partner violence screen. So, have you been kicked? Asking pasyente, punch, hit, or otherwise hurt by someone in the past year? If so, by whom? And do you feel safe in your current relationship? And is there a partner from a previous relationship who's making you feel unsafe now? No? Sometimes mag-assess ko yun na ang partner or someone else kung tiguang na ang anak or inana kanang someone may kuan kanang active kay nga motubag or before ko start sa assessment kung are you comfortable assessing you in front of him or you want us to leave, or sometimes din ako mga tanong dito na ko, excuse me sir, can you leave us because I'm gonna do an assessment. Ano na ko, patient presentation. So patient may come in the emergency department with head and neck injuries, fractures, contusions, sprains, strains, skull fractures, pregnancy complications, dugo, vag bleed, or open wounds of the head, neck, or trunk. Most common presentation mo na siya, no? Na gituok, no? Na mga pasa, bruises. Tana din ka, no? Assess din ka for kuan. Next is presence of old injuries, no? Siya mga old scars or nag-yellow nga part kay maway pag-ayo. Complaints, abdominal pain. Usually they come to the emergency with this complaint, abdominal pain. Kikulatan nito sila, back pain, kung nito sila, pelvic pain, UTI, because of, headaches, anxiety, substance abuse. Gamiton sila. When I was young, nag-abang ng balay ang tag-iya sa balay ng gibangan kay abuser, drug abuser. Kita ko, mag-suyop sila yung human, mag-away, ganito dayon. STI, kay ang bana na may nasilain nga kuan, or sex or symptoms of post-traumatic stress disorder. Patient behaviors, concerns about confidentiality, no? Sila nga, no, di lang kumusulti kay naamang good si kuan, or basin yung may baw ang tanan, no? Comments regarding their carelessness or stupidity in getting hurt, no? Kung tong sa mana din sila, no? Mga victim. Fear of their partner leaving them in the emergency department and appearing anxious to leave or to get their partner out of the room, no? So, ikaw as a nurse, you have to be conscious. Can you leave us, sir? Because I'm gonna assess the patient. No? Abusive partners stay very close or even respond to questions for their partner. So, na yung mga culture nga, ang bana may mo answer sa pangutana. Yeah. Ako maglagot ko, mairitar ko, ana, kay dili ikaw kung i-assess. I'm not asking you. I'm asking the patient, no? So, usually, kaya mga tao, mga partner nga matubag para sa ilang kuan, na careful na din maana, no? Abuser may also be abusive, of course, and demanding towards staff, no? Sila na ang kanang magkuan na yun, karon lang ka mag-assessment, karon ganihan na, himkuit na sila scene, aron di mo sila hilabtan, no? So, sa Ontario na atay kuan, kanang reporting procedure, anyway, i-report sa police, no? I mean, ani nga kuan. Dili ka mapriso kung mo-report ka. Pipila rin pag kuan, police mo, kuan na sila. Yeah, one time na dyan yung pasyente nga akong gipangutan na, do you think you're unsafe? Or do you think you're being abused? Ano, so why na kuan? Yeah, akong gibuhat, sulti din ko sa charge nurse. Yung charge nurse na rin communicate sa police. The role of the emergency nurse. So, evidence collection, sexual assault kit or photographs of injuries, test for na sexual kit, kami na sexual kit, and test for pregnancy and STI, use of specially trained staff, forensic nurse examiners or sexual assault nurses, and collaborate with law enforcement, no? So safety planning and referrals, safety plan tool to help the patient prepare to leave if the situation escalates and the initial crisis begins immediately. So how to document? So responses to all screening and safety questions. You may document, okay? Document verbatim, and meaning to say word for word yun yung na incident surrounding the injury or other physical complaints using the patient's own words in quotation mark. Magin yung gamit. Dili mo isuot mo interpret. Maroba na yung problema nato, no? Interpret nato ang isulti sa the patient is anxious na dili. Mingan na patient nga. The patient reported, quote unquote, I am very anxious. My husband is, According to the patient, may has an quote-unquote good ka accurate descriptions of all injuries using a body map. Kana bitaw na sa soko nga body map no asa dapita ang injuries imo na i-document. And using body map to mark location and size and support this with photographs. So, and then be familiar with mandatory reporting. This is what I'm telling you, mandatory reporting. Dili kay priso kung sa imong report, but kinahanglan nimo i-report kay kuan man. Each state has a different style of mandatory reporting. The Philippines, I don't know, unsa na. Pero dinhi kay na isulti na ang charge nurse. Charge na bahala ng tawag og police. So, our next topic is sexual assault. So, every 98 seconds, an American is sexually assaulted, no, according to Sweet and Foley 2020. And in Canada, 1 in every 17 Canadians, especially women, is raped at some point in her life. And in the Philippines, 7 million children are sexually abused every year in the Philippines. No, ano ko sa news na sa napulapom siguro to nga maligya lang mga anak sa mga European national through online. So the FBI defines sexual assault to include both genders and oral and anal assault. Sexual assault involves force and consent. Even if not consent, no, pwede gawin siya sexual assault. No? Sexual assault is not a crime of passion, but not a crime of passion, but about power and control. Okay, findings from research indicate that 17% to 18% of women and 3% of men experience rape or attempted rape in their life. No, so there's several kayong mga movies it occurs across sexual denominations. And also in 2011, a survey reports that lesbian and bisexual women are 3 times more likely than heterosexual women to be sexually assaulted, and gay men may be 15 times as likely as heterosexual men. LGBTQ persons are sexually assaulted for the same reasons as heterosexual women. No, parehas ang rason na. No? All survivors are the same level of compassion and recognition. No? So, luoy pod, no? Nya, dili na siya pwede nga imong joke ang rape. Dili ko ginahan. So, una magklase akong maestro ani kay himon yang katawanan, no? So, kailan kayo gid ako maestro sa college. Ako ang maestro sa master's degree, and ako maestro sa review, no? Ilang basta yung ani sexual assault nga klase kay himon nilang katawanan, which is not funny and very serious, no? Dili siya katawanan. There are different types of rapists. The first type is the power assertive rapist. Second one is the anger excitement rapist, sadistic rapist. Ang nadungan sa una kay sadist rapist sa psychiatric namo, and then the opportunist. So the power assertive rapist is the most common, no? The objective of this rapist is to control but not harm. The rapist will be repetitive and attack frequently. Okay. Second one is the anger excitement rapist. This is the most dangerous one. The person wants to harm. Okay, the rapist wants to harm, and murder is the ultimate gratification. So mo ni ito ang sadistic. Iba ni mo ang sadistic, no? Pleasure is one of the most dangerous too. So the anger excitement rapist and sadistic rapist are the 2 most dangerous type of rapist we have, and we have the opportunist. So from the word itself, opportunist, as I've said, rape is not a joke. Hindi na siya pwede a joke, no? And in the Philippines, and for the last years, daghan kaayo jokes about rape. So we'll talk about myths and misconceptions of rape. Okay, so victims did something. So the first one is that victims did something to make them responsible for the end result. No, so sila ang sadaan. No, usually dili gid sila ang sad-an, no? So as I've said, in the Philippines we have a lot of celebrities and even politicians joke about rape, no? First one, you have you're most familiar with her. This is the comedian who made gang rape jokes to a media host or media personality. Yeah, received check flack because of that. No, the flack from the internet. Again, next one is the Philippine president, the previous ex-president, the former president, says from this one is taken from Washington Post. Says the Philippine president says, so long as women are beautiful, there will be cases of rape. They said it's a joke. They downgraded it as a joke, but still, rape is not a joke. It is serious. No? And this one here, Pangasinan Police Provincial Office created their tips on how to prevent rape. They said, iwasan magsuot ng mga damit na nakakapang-akit. Pwede na, sir. No. So, tinanta magsulob ani ang kuan. Mga sarina nga makapang-akit. So victims, another myth is that victims drink too much or uses drugs, they deserve to be raped. No? They deserve to be raped. Next one is, of course, only if a penetrator uses physical, and also there should be injuries. No, pwede man wala ka injuries kung rape ka. No, if two people had consensual sex with each other before, it is always okay. No, ako ikuan sa una silingan nga wala na yung motuon niya, no, kay sige naman siya gi-rape, no, yun lang, uyabe na sila, yabe ang bana, no. People who are sexually abused as children are likely to become abuser, no. People who are abused when they were a child would likely be having IPV later in their lifetime, but doesn't mean that you're abused as a child, sexually abused as a child, you will be a sexual abuser later on in your life. No? Clarify na nato ha. Women are most likely to be raped after dark by a stranger. So some believe women should not go out after the dark. And the matter of fact is, rape happens at home. No, it's either your dad will rape or their uncle, anyone, brother in the house. No, diha magsugod ang rape. No, sa balay, dili necessary nga naglag-lag, nagkiat-kiat. No? So rape trauma syndrome. This is we have a stage for this. We have acute, outward adjustment stage, and renormalization. In the acute stage, this one is very intense. The victim expresses disbelief or shock. So the patient is restless, tense, crying, sobbing, or appear calm, no, or composed, or with subdued effect. No, sayo maghilak sila o sayo magtanga, no. Outward adjustment stage, victim seems to resume normal life but suffers with internal turmoil. Hindi po na feel. There is numbness, disorganization, dulled senses, dili na sa malipayon, no. Yeah, makita yun mo, dili na sa malipayon. Vomiting, obsession, hysteria, sleep disorders, dislakatog, and anxiety that lasts for months to years. And then renormalization. Survivors recognize rape is no longer the focus of their life. Unlike sa outward adjustment stage, nga mo gid lang pinamintin niya ganoon na sa acute stage. Sige go balik-balik, sige balik-balik. But in renormalization, survivors recognize that rape is no longer the focus of their life. The sexual assault behavior in the emergency department. So when a victim comes, they need to be triaged with high priority in a private area, and staff needs to develop trusting relationship. Smile as appropriate. Ako smiling kay ko, but in this case, kung nakoy pasyente nga na ay sexual assault, serious kita na. And listen, don't give unnecessary jokes, no. Listen and explain what happened to them during the examination. And questions to ask are about pertinent medical history and overall complaint. Put all statement in quotes. No, what happened to you? Did you have any injuries? No, do you have any bruises? Are you in pain right now? So muna yung mga question. Put it in quotes. No? Maraming mga na dili kay magmarites. Mingon ka, kinsa man na siya. No? So maraba na mayor ni. Kung ano ba kay ta marites ra kita yung uban mag-alirong na kay maminaw. No? Common kini sa Pilipinas. Wa sabot nganong common kay nato nga marites. Dili pwede ngin ana. So private gid ni siya nga conversation. Ikaw ang nurse, pawaon nimo mga tao, no? Mga na gani mo mga kauban which is not part of the team sa take care sa pasyente. Ayaw sulti, no? I've heard a lot of Filipinos mga un sa canteen mag-istorya about sa ilang pasyente, which is so bad, no? Initial priority is to determine the presence of physical trauma, no? So ER ta, physical trauma tong tanawon ni. Notify sexual assault response team at SART kung naamuan ni sa inyong hangguan. So these are specialized team developed to address the lack of support for victims of sexual assault. Examiner were the members. Sexual assault examiner, rapist. No, not the rapist. Sorry. The rape crisis advocate, law enforcement officer, and the legal counsel personnel. So sa hospital yung trabuhoan na asa legal counsel. Nga naagid kung yung request maabot. Inform the patient that their actions help get them through the ordeal and regardless of what action was taken. No? Napatay niya ang rapist, no? Kuan nimo nga tagaan mo reassurance nga kuan ay imo nang nabuhat kay you wanted to survive, no? Dili gini mo intention nga mao ni mahitabo. Now let's check a nurse is to start her assessment on a victim of sexual assault. Which of the following questions are correct? A. Are you in pain? B. Do you have cuts or wounds? C. Were you wearing sexy clothes during the incident? And D. Do you have anything else that you would like me to know or become aware? The sexual assault survival in emergency department. Remind the patient that they did not cause the assault. No. Remind survivors of their bravery in coming forward and stopping the cycle of the penetrator. No. Appreciate them. You are so brave. And most states have a kit, a step-by-step instruction sheet, and a standard documentation. Standard documentation must be developed aron the same information yung ihatag sa imong records o sa imong law enforcement. No? So, and this kit must be given to the law enforcement, the criminalistic laboratory, hospital, to ensure that evidence are collected in the same way, walay contradictions. Okay. The examination begins. So this is how the examination begins. So only trained staff are allowed to do this. Consent. So in emergency situation, consent is assumed, but in this case, it should be obtained ASAP. No, what are consent that the doctor has to obtain is for not only for the care but also for photography. So the patient has the right to refuse. Be aware of the age of consent. Here sa Canada, kung ang bata maka-give na consent, okay na siya. No, wala gitawag age of consent. Pilipinas, I'm not sure. 18. Patient can remain Jane Doe during the examination, so they can remain unknown. No, Jane Doe is just synonymous to unknown. Do not force victims to sign. No? Mas tingnan mo sign, ayaw sign na. Inform patient if law enforcement is notified. No, ang Islam shot. Naban na mahal. History. Medical history should be obtained before the examination is started. Examinations performed within 72 hours are optimal. No, but it can be also evidence can be obtained 5 to 6 days afterward. If the patient is not comfortable, no, it's like ginahano pahikap. Questions are done in a way that the patient understands the question. Okay, make it simple. Never change the patient's words. No, verbatim, quote unquote. Write only the words the patient tells you and use quotes. If the patient is drugged or intoxicated, the examiner must complete a comprehensive and thorough examination. What drug? Mga question mo for substance abuse. And number one substance used in drug-facilitated sexual assault is, or DFSA, is ethanol. Diba? Most abused alcohol. Yes, ethanol. So, physical examination and evidence collection. Note the patient's appearance and condition of clothing before asking a patient to undress. Yung nang specific, kung take a picture. Yung nang i-describe. Ask the patient to stand on white papers to undress. Why in a white paper? Ano ko na yung mga hog na hair, yung mga hog na substances, makolect ni mo. Place each clothing to a paper bag, a label with description of the clothing. No, all articles must be dry before inserting to the bag. Kaya mag-moist na, mag-fungal, mag-contaminated ang evidence. All evidences are turned over to law enforcement, and the nurse must make sure to document the number of evidence bags that is given to the officer. And then patient is dressed in a gown. Okay, ask the patient kung sa iyang comfortable level. And then nurse must patient head-to-toe assessment is done, looking for signs of any injury, and use ultraviolet light if available to trace evidence. No, semen may appear orange or blue-green on the skin when you blue-green on the skin when you use ultraviolet, and swab the area with a moistened cotton tip applicator. Injuries may appear as red mark but changes color over time. So follow up a photograph on a later date by police department. Can be done. And oral buccal swab will be obtained for victims DNA to compare kung ang katong semen nga sa skin o sa iyang DNA parehas na ba. Mo comparison. Physical evidence, physical examination and evidence collection. Finger scrapings are also collected for perpetrator's DNA. Okay, usually lam ng kambraso ng luyo, di ba? Documents all injuries. For the female patient, pelvic exam begins with visual exam. External genitalia is swabbed. No? So, for the male patient, scrotum and the penis needs to be swabbed. Hymen also is examined, and a speculum is used, and the swab is obtained from vaginal wall and cervix. Ang speculum day kay disposable and transparent ang among one. Photos are used to detect and document genital trauma. Pubic hair are collected. So, dili na sa una kay putlon, laruton ang buhok, ang pubic hair. Kaya kay katorang matangtang. Sorry. Rectal examination and inspection is done. Swabs are also obtained. The nurse should limit handling of evidence and take care not to leave any of his or her own DNA on the evidence. Don't touch it with an ungloved hand. Yan, kung nag-glove mo ganin ka, change your glove oftentimes. I do, nag-collection ko din butang sa swab, ilis o gloves. Butang sa glain, collection din nana akong style. Chain of custody must be maintained during and after the examination. Okay, so the nurse should make sure that she's able to prove that the evidences was never left alone and that there was no tampering of the evidences. Kay kuya no, evidence needs to be transferred from nurse to law enforcer. Okay, nurse somewhere else and an enforcer. All evidences must be included in the paperwork. So ang imong documentation na nga ang evidences kay nagid sa imong eyesight all the time. After examination, victim is exhausted, right? And patient is escorted to a private area to shower and change fresh clothes. Patient's medication management for post-assault care is also important. Mga anti-anxiety medication. And CDC recommended prophylactic for STIs, for trichomoniasis, bacterial vaginosis, gonorrhea, and chlamydial infections. Prophylaxis for HIV and Hep B are given as well. Consent for pregnancy prevention and inform for associated risk. No, natin plan B, inform pasyente. Pwede sad kanang mag-open up na for abortion. Kung ginahan ng pasyente to pursue with the pregnancy kung positive siya. Follow-up care should be done in 10 days to 2 weeks. Okay, referral to gynecology on a nearby clinic. Cultures can be taken at this time. HIV testing can be discussed. And SART can accompany patient in court. Legal aspects, no? So the nurse may be called to be a fact witness to the examination and may receive subpoena. No, sabinahan ka sa korte. A nurse only give facts, must remain from expressing bias through opinions and emotions. No? Ato ka sa korte, ayaw istorya sa mga butang nga wala mo nakit. Kanarang nakitaan, 5 senses nakitaan, na smell, na touch, na ana. No, other than that, dili ginahan ang korte sa imong opinion. No nga. I think the patient was anxious. No, I think she looks unwell. Before the hearing, the nurse should review the record and communicate with the legal representative. The nurse with a master's degree should have a CV brought to the courtroom and must be prepared to describe his or her education experience and sexual assault training. Attire should be professional and businesslike. Di mo adto nga nag-scrub suit, no? Di mo adto sa korte nga nag-t-shirt o jeans, no? Professional and businesslike. Okay, professional ba yata? Nurse ba yata? A nurse should only answer what is asked. Face the injury with eye contact and confident and calm. Mao na, no? So imuhang pag-adto is a fact witness, no? Witness of the kuan kanang mag-abot sa pasyente, unsa gina-collect, ana. Other than that, una sila pakialam sa imong isulti. So we're now in biological threats. So last portion na ta. We have anthrax, we have smallpox, and botulism. So anthrax is caused by Bacillus anthracis. Smallpox is caused by variola minor or variola major. You know, with pictures, sa pictures, and botulism, Clostridium botulinum. And kung nakita mo ng kuan na rocket, no, mo na kasagaran container sa kanang kuan kanang nga kagaw, no, isod na diha iato nila sa kanang area. So biologic threats include bacteria, viruses, and toxins. We'll give one of each. atong classification A lang. Bacteria is a single cell microorganism, as we know it in our second year, no, sa atong biology class, that may form spores and produce a tissue inflammatory reaction. Viruses, kanina aware na gyud ani for the past 3 years, are the simplest pathogen, no, consisting of protein-coated RNA or DNA, and requires host cell and can cause a variety of cell-specific diseases. Viral diseases may end in vascular damage and multiple system organ failure. So toxins are nature's poison and are more deadly than comparable amounts of any man-made chemical agent. Infection methods, pwede inhalation, ingestion, injection, and dermal contact. A biological attack or infectious outbreak will be insidious. Yes, there will be clues. So there will be clues of infection, unusual geographic area, no, kanang area na isakit. Increased deaths among the immunocompromised. Multiple similar outbreaks of disease, multiple drug-resistant pathogens, increased or many sick and dying animals in that area, physical evidence or agent-delivered device, pero ng rocket, na yung mga rocket, so yung biological weapon na ni, biological warfare na ni din. So mo na yung mga indicators nga na ay biological threats, and the nurse should be aware of that. So let's talk about anthrax first. So anthrax, Bacillus anthracis is the bacteria that cause this. So according to CDC, category A bacteria. This is a category A, so the highest, no, apex bacteria. Bacillus anthracis is a rod-shaped, gram-positive, spore-forming bacteria endemic within certain agricultural regions and livestock population, and may cause Wolster disease from handling contaminated hides of fluids. Inhalation anthrax are the most lethal. We have 3 kinds of anthrax. The cutaneous anthrax is the skin, no? Itching skin, papular lesions that becomes vesicular and ulcerative. And GI anthrax is kung upper GI na siya na edema, lymphadenopathy, and sepsis. Kung lower GI na siya, kaya na bloody diarrhea, ascites, abdominal pain, and sepsis, and associated with necrotic lower intestine. And if inhalational na siya, initially it feels like having flu, and in 2 to 6 days, ang iyang incubation period and followed by dry cough, myalgias, painful muscles, fatigue, and fever. And then victims may feel sudden improvement, followed by sudden onset of high fever, respiratory distress, shock, and death, possibly within 24 to 48 hours. No? Ana ang kuan sa imuhang anthrax. No. By the way, always remember that unless otherwise not stated, my source is The Sweet and Folate 2020 nga libro nga kuan emergency nursing. Treatment for anthrax is standard precautions. Standard precautions are needed for for health personnel treating persons with anthrax, infected with anthrax. Avoid contact with wound drainage. Kay mao na yung sigaran, no? Requires culture and antibiotics, ciprofloxacin, levofloxacin, doxycycline, and penicillin, and supplemental oxygen supportive. Okay, managing respiratory compromise, supportive care, 6-course vaccination regimen in the Department of Defense in the United States. Na sila ana para sa ilahang mga military, but the civilian vaccination is being developed by CDC. So planning. Hospitals, including the emergency department, should have protocol and or plan to deal with potentially contaminated male and white powder events. In September 11, 2001, katong nahitabo sa New York City nga attack. After that, nauso dayon ang anthrax nga powder. So a lot of males containing anthrax powder kay ni-scatter all around the world. I remember nga akong ipada nga mga pictures sa akong ate padong sa New York, padong sa North Carolina. Wala naabot niya kay because they thought nga anthrax. I didn't write my so una hinihilig ko og surprises. So ako gibutang akong address, no? So ang gi-junk ang akong mail. Ako ang gi-junk ang akong pictures. So report suspected cases to the infection control practitioner and public health official. So for this patient, when you take care of this patient with anthrax, use standard precautions and avoid wound drainage or contact. So mahibaw man ka kay mo report mo ng pasyente nga ini triage nga nakasimhot sila og kuan powder gikan sa male. So suspect nga anthrax siya. Standard precautions: use hand hygiene and use personal protective equipment or PPE, gloves, gowns, mask, eye protection, and face shields. Knowledge check number 4. Which isolation precaution the nurse will apply for a patient infected with anthrax? A. Standard precaution. B. Contact isolation. C. Airborne. D. Droplet contact. Sorry. Smallpox. This one is a category A. CDC category A for virus. The other one is bacteria. This one is a virus caused by variola minor or variola major, most probably variola major. Highly virulent and contagious disease that spreads from person to person by aerosol or droplet nuclei via cough, sneeze, and direct contact. No? So ito ginahani kay kwan kini siya. Airborne ni siya, no? Only specimen can be found in CDC laboratory Atlanta, Georgia, and Vector Lab in Moscow, Russia. Anywhere else, wala dito di mo makita smallpox. Nara sa Atlanta, Georgia, sa laboratory sa Atlanta, Georgia, and Moscow, Russia. Edward Jenner's cowpox vaccination prevented the spread of smallpox. So mo na siya. So dinhi we believe, I hope nga wala sa tong class ang dili mo to og what they call this, who are kanang mga conspiracy theorists, no? Hindi mo to tag vaccination. And one of the example kaning si Edward Jenner, no, iyang cowpox vaccination, it prevented the spread of smallpox in the world, no? So naghope lang ko nga none of the students here nga naminaw karon kay kuan mga conspiracy theorists. So always believe in vaccinations. I for once had vaccinations for COVID, and I feel great no pag naka-COVID ko once and wala ko'y signs and symptoms. So manifestations of patients with smallpox, strict airborne and contact precautions should be applied for this patient. Inoculation, of course, via face-to-face encounter or contact with infected body fluids, contaminated objects, vectors, and beddings. Incubation period is 7 to 17 days, after which virus spreads to lymph nodes and multiplies in the body. First symptoms will be high fever and may include malaise, headache, body aches, and sometimes nausea and vomiting. The next 2 to 4 days, the most contagious phase. A rash develops in the tongue and in the mouth. Rash spreads to the face, arms, legs, and distally to the hands and feet. The rash evolves into fluid-filled, painful bumps that later thickens and develop a characteristic central depression or in the umbilicus. Fever rises and the bumps turn into sharply raised pustules that cross over the scab, and the person is considered contagious until the scab fall off. So muna siya sa smallpox. Treatment for smallpox will be negative pressure environment. Nagkagana sa airborne negative pressure. Mean to say it allows only the entrance of air. Dili magawas ang air. And contact infection control precautions. Airborne and contact control. Diagnosis is by clinical presentation, positive tissue cultures, positive virus identified with electron microscopy. Supportive treatment like oxygen, diet, and antivirals and immune globulin may aid in treatment. Vaccination is the most important tool. So, smallpox planning. Any case of smallpox indicates bioterrorism. Any kay nga duha man to ang nasa Moscow ug sa nasa Georgia, and is considered a crime. So, identify a response team within the emergency department whose members are protected by recent smallpox vaccination. Report suspected cases to the infection control practitioner and public health officials. Now let's check number 5. True or false? Any case of smallpox is considered a bioterrorism. Not a boost, it's a bioterrorism. A. True. B. False. Maybe. I don't know. D. Botulinum is a category A, CDC category A toxin. So Clostridium botulinum is the spore-forming anaerobacillus that provides botulinum toxin and is the most poisonous substance by weight known. It is a neuropathic disease. It causes a neuropathic disease occurring naturally in 3 forms: foodborne, infant botulism, and wound botulism. Inhalation botulism would be a natural, and it is a result of biologic. It is a result of a biologic attack. So, properly manufactured, dispersed, and inhaled, a single gram would kill more than 1 million people. Or this is like botulinum or botulism. Manifestation signs and symptoms begin 6 hours to 2 weeks after exposure and are the same for all forms of botulism, include inhalational. So neurologic symptoms: symmetric, descending flaccid paralysis with bulbar palsies, including ptosis ng mata. Tawag itong picture, yung ipakita, mata. Blurred vision, diplopia, dysphagia, and dysphonia. Patient may appear comatose, requiring months of mechanical ventilation before recovery. Can you imagine? Mag-botulism ang mga tao niya. Gamay na kay tagkuan. This pandemic has shown nga gamay na kay tag-ICU. Clinical diagnosis made by bulbar palsy with descending paralysis. Halimbawa, mata, humbag, then descending paralysis. Confirmed diagnosis by cultures, Clostridium botulinum cultures, and mouse neutralization assay test. Botulinum treatment. So we initiate standard precaution for these for the treatment, and early use of specific botulinum antitoxin after rapid diagnosis, and supportive care, extended mechanical ventilation, in enteral or parenteral tube feeding. Now let's check which isolation precaution the nurse will apply for a patient infected with botulinum. Standard precaution. B, contact isolation. C, airborne. D, droplet contact. Sorry. Planning. Report suspected cases to the infection control practitioner and public health officials. The emergency department or hospital encountering botulism should consider foodborne substances, including home canned products and potential contaminated illegal drug use. There is no person-to-person spread of botulism. Knowledge check. True or false? There is no person-to-person spread of botulism. A, true. B, false. C, maybe. D, I don't know. Our next topic is COVID-19. Since the publishing of our reference book in 2020, there's no mention of COVID-19. So this one is taken from the place where I work. The cause of severe acute respiratory syndrome coronavirus or SARS-2. Again, the source of severe acute respiratory syndrome coronavirus 2 is the novel coronavirus, identified as the cause of cluster of pneumonia cases in Wuhan, China in December 2019. The likely source are bats. Diagnosis is to be diagnosed, you need to be tested for COVID-19 and other respiratory pathogens, influenza and RSV, due to its similar presentation and co-infections possible. Right now is the year 2022. In the hospital, there's a combination of COVID and influenza together, So that's why people are to be checked with influenza and RSV. Diagnosed through a throat or nasopharyngeal swab. So in Canada, we use the nasopharyngeal swab. In the hospital where I work. So risk factor, severe illness can occur in otherwise healthy individuals, any age, but predominantly of course in adults with advanced age or with pre-existing medical comorbidities. Yung mga parents na yung mga medical comorbidities, ayaw sa, according ni Leo Lastimosa, ayaw sa papila o mga kiat-kiat, Okay. Comorbidities like cardiovascular diseases, high blood pressure, heart diseases, diabetes mellitus, hypertension, chronic lung disease, cancer, chronic kidney infection, diseases ay sa papila ninyo mga kiat-kiat, Kay basin niyag ma-infected sa virus, madali ang atong mga parents, Inyong mga pasyente po, do a health education about this. Route of transmission, droplet, respiratory droplets, droplet and contact. So respiratory droplets greater than 5 to 10 micrometer in diameter, and respiratory droplets do not travel more than 2 meters, 6 feet. So muna siya in the knowledge that the droplets do not travel more than 2 meters or 6 feet and do not linger in air. So they don't suspend in air like we previously thought. And contact through fomites in the immediate environment around the infected persons, 2 meters within the room. So touching contaminated surfaces and touching one's eyes and nose and mouth will have you infected by this virus. Reduce risk by hand hygiene, avoiding touching of the face, and disinfect contaminated surfaces. Now let's check which isolation precaution the nurse will apply for a patient with COVID-19. A, standard precaution. B, contact isolation. C, airborne. D, droplet contact. COVID-19 symptoms: fever, dyspnea, cough, anorexia, myalgia, fatigue, sore throat, nasal congestion, mild pneumonia, headache, anosmia, and dysgeusia, loss of sense of taste or smell. Rarely, patients may also present with diarrhea, nausea, and vomiting. So na morning a symptom, please have yourself checked. Serious complications are pneumonia. Pwede matay yung pasyente. Kapila na kung nagpadaw pasyente sa ICU because of pneumonia. This is the most common serious infection or manifestation. It could present itself as mild to severe. Fever often lasting for 12 days, fatigue, dry cough lasting for 12 days, dyspnea, bilateral infiltrates or chest imaging, tachypnea, decreased oxygen saturation less than 83%, managing supportive oxygen hydration, antipyretics and analgesics, and monitor patient closely for changes in respiratory status. Patient can decline rapidly. Manabantayan ninyo yung pasyente with COVID-19. Another serious complication is sepsis. So, serious systemic dysregulated inflammatory response to infection or bacteremia resulting in organ dysfunction. Ano kay ang virus magud siya kung matake na siya sa body, it gives way nga mabuhi ang uban nga mga microorganism like the bacteria. Consideration IV access. So always have IV access for this patient. Fluid management, hypotension, and tachycardia. Antimicrobials should be given sa pneumonia and sepsis too, and intake and output to determine kidney function. Monitor your level of consciousness. Signs and symptoms: fever, hypotension for sepsis, fever, hypotension, tachycardia, leukocytosis, warm, flushed skin, cool skin, altered mental state, difficult or fast breathing. You know, most like you described how primitive as like goldfish out of the aquarium. Low oxygen saturation, oliguria, anuria, weak pulse, and lethargy. Septic shock. Another serious complication caused by vasodilatory or distributive shock. Treatment: aggressive fluid resuscitation, vasopressors, antibiotics, supportive care, balanced fluid resuscitation. Acute respiratory distress syndrome, ARDS. I think we already had discussed this before. No, sa ito ang respiratory infections, acute emergencies. Major complication in patients with severe disease and can manifest shortly after the onset of dyspnea. Cause is direct or indirect acute diffuse inflammatory lung injury, and risk factors are age greater than 65 years with diabetes and hypertension. Median onset of ARDS was 12 days. Management is oxygen support, intubation, and mechanical ventilation. Conservative fluid management when there is no evidence of shock. And signs and symptoms of ARDS, at learning mentioned sa una, is decreased oxygen saturation, labored and rapid breathing, tachy, hypotension, acute confusion, diaphoresis, and cyanosis. Cardiac injury. Symptoms. A minority of patients with evidence of myocardial injury present with cardiac symptoms such as chest pain or palpitations. Troponin is greater frequency and magnitude of troponin levels associated with severe disease and worsened outcomes. Late complication develops after respiratory illness improves. Assessment. Know the code status. Maintain 2 meters distance and avoid longer than 15 minutes so of close proximity. So sa kwarto, 15 minutes sa gumigawas na dahil me. Remove na namang mga gown. So conservative fluid management for this patient. Older adults are more at risk for malnutrition. Cognitive and depressive symptoms should be managed comprehensively. No, depressed sila. May tao sa room. Make sure to insert patient hearing aids if applicable kung nagamit sila. Always remember to manage your symptoms while keeping yourself safe. Respiratory assessment, vitals every 4 hours, frequent if there is a change in vital clinical status. Observe and monitor for work or breathing. No, say how do they breathe? No, labored breath. Takip niya, dyspnea, signs of cyanosis nung lagom na ang linhe. Accessory muscle use, posture, no, gana. So oxygen saturation, anxiety, and assess for pain as well. Respiratory assessment, auscultation. As of this time, not part of assessment, but karong as of like during the peak of the pandemic, di mi pwede mag-auscultate kay close proximity. So karon kay pwede na. So imo lang i-disinfect ni mo ang kuan. Early detection and trending in patients' oxygen requirements and respiratory status is necessary. Minimal contact is key with these patients, but paying attention to respiratory changes is very important. So now we use technology and cameras. No? Now let's check true or false. Minimal contact is the key with COVID patients, but paying attention to respiratory changes is not important. Remember, true or false, minimal contact is the key with taking care of COVID patients, but paying attention to respiratory changes is not important. A, true, B, false, maybe, and D, I don't know. COVID-19 still, identifying respiratory compromise. Elderly patients may present with mild symptoms but have a high risk of deteriorating quickly. So you have to always monitor them. Attention to increase in respiratory 20 to 30 is moderate. greater than 30 is severe. Tachycardia, increased auto demands, discolored skin or nails, no? Grunting, sweating, chest retractions, patient leaning forward in bed, no? Patient may appear anxious. Oxygen therapy, early recognition in increased work of breathing and increased oxygen demands is critical to ensuring timely and safe escalation of respiratory support with optimized supportive care treatment. Non-aerolizing oxygen therapy, nasal prong, 6 liters per minute maximum. Oximizer, 12 liters. Venturi mask. Search na niyo sa Google kung saan ang Venturi mask. Non-rebreather mask, 100%. And dry trach mask. So, dry trach mask, mura siya Venturi mask. Yan na, aerosol generating oxygen therapy, non-invasive positive pressure ventilation, CPAP or BiPAP, high flow nasal cannula, and humidified trach mask. So non-aerolizing and aerolizing agent. COVID-19 still, escalation of patients. It is important to recognize changes in a patient's condition as patients can decline quickly. Focus on early recognition, early intervention, and early escalation. So in our hospital, this is how we intervene very quickly. So we look at this. So the first one that we take, the first change that we take a look is the airway here. It's the criteria for calling CCRT. Remember the critical care response team that we mentioned before? So these are our assessments. So airway. So is it threatened, stridor, excessive secretions? The breathing is greater than 30. Distress breathing. Saturation's not improving, regardless of oxygen supplementation. Okay. Circulation. Systolic blood pressure less than 90 or greater than 200. Heart rate is less than 40 or greater than 30. Neurology, decreased level of consciousness, and others. Okay, so the way we call in CCRT and we say, hi, I have a patient here, last name is John Doe, she's 64 years old with diabetes and hypertension. Patient is diagnosed with COVID-19 as of this moment, is receiving 6 liters of oxygen, febrile, and the patient is showing respiratory distress. I think a moderate, so a moderate, more than 30. Let's just say more than 30 respirations. Despite oxygen supplementation, patient cannot maintain saturation of 100% or greater than 93%, and the patient's level of consciousness is deteriorating. This is how you give report, and then they will come and see the patient. Psychological needs of patient. So be a good listener, reassure patient, kaya hadlok mo na sila, find balance of information, ayaw paggamit ng mga information sa social media nga kuan, di mao. Encourage patient to practice relaxation. For pre-existing mental illness, ensure medication is ordered, keep them distracted, remind them that they are resilient, they're strong, they can do it. Isolation doesn't mean that they should cut all communications from relatives. They can call, they can use FaceTime. So before, we use FaceTime and Zoom. PPE donning and doffing. Follow all proper PPR requirements. Ensure that when removing the gowns and gloves, it is within the patient's room. Gowns and gloves within patient's room. When removing your mask and shield, do this outside the room and into the appropriate bin. Drop the contact precautions for routine care, gowns, gloves, surgical masks, and face shields. Airborne droplet precautions with N95 mask when performing aerosol generating medical procedures. The key to safety is proper donning and doffing and frequent hand washing. Now let's check number 9, true or false. The key to safety is proper donning and doffing and frequent hand washing. So COVID-19 still putting on personal protective equipment, perform hand hygiene. So if you can see, this is the your left is the putting on personal hygiene, perform hand hygiene, put on gown, put on mask or N95, put on eye protection, and put on gloves. Okay, in removing, remove gloves, remove gown, perform hand hygiene, remove eye protection, remove mask or N95, and then perform hand hygiene. Safety and healthcare provider is our primary concern. Minimize close contact, ask patient to turn their head away from you, engage patient in elements of their care, use technology like FaceTime, Zoom, or telephone when close proximity. Sige, kani bang pasyente ng COVID, sige tawag. No? Can you come to my room? No, ano niya sila. No, one time, ipasod ko sa room ko. Kung sa may kinahanglan, no, I want you to be here. Pato na ko ito. Can you apply orange oil in my back because I can't sleep? Ano na sila. So, you have to tell them that this is a minimized contact, and you have, when you come to their room, make sure that everything is like naatanan ba. Pili kay usa-usa. No po, usa-usa na sila manugo. When close proximity is required, provide close care and then step back frequently. No, always step back frequently. Minimize number of staff exposed to the patient and ensure you're wearing appropriate PPE. Allied services will do their own screening to determine what requires direct or indirect care and more. When a patient dies because of COVID, we call it, or the heart stops, and then we call it code blue. We call it, during the COVID-19 pandemic, we call it a protected code blue. So we wear PPE and then N95 mask, and safety office, there will be safety officer. So this is our secret, no? Secret military or secret strategy, a safety officer. So safety officer is there to monitor how people wear na PPE o as sila nang hika, no? And manage the kuan. Remember we talked about code blue last time? So this is the same safety officer. After the code is complete, clean PPE must be worn by the healthcare team upon transfer to ICU. Patient must wear surgical mask during transport, and after patient leaves the room, close the room for the appropriate time following an HMP. So aerosol generating activity, no? So depending on the presence of heat filter and then HEPA filter, and then a terminal clean is done. Like terminal clean, like we use what do you call this? Chlorine or Lysol, no, sa room. Dili kita malimpyo, ang mga cleaners malimpyo. After death of the patient, if the patient is unlucky, after code blue, namatay ang pasyente, sa imuhang aerosol generating procedure, medical procedure, aerosol generating medical procedure, close the door for the appropriate time, allows a settle time. Diba? Islam suspend in air, lower down sila 2 meters. So, human kay, if death does not occur following an HMP, wait for the time, the wait time is not needed. Okay? So, preparing the body, wear gloves, gowns. So, ikaw maputos sa lawas, no? Wear gloves, gowns, surgical procedure, mask, and face shield. Wipe down outer surface of the body with oxygen. Sa outer surface of the bag, body bag. The body bag, handili ang body sa patient. Body bag with hydrogen peroxide or any available disinfectant. Label the bag with infectious risk, handle with care sticker. Discharge into the community. So if the patient is lucky, tell the patient to follow, get yourself a pre-discharge checklist, living arrangement, and transport of the patient. Patient and caregiver education is critical because for patient and public safety. Advise patient that public health will follow up. Utilize translators. Ensure patient has a mask to wear at home during transport. And patient discharge resources, self-isolation advice, how to self-monitor, self-isolation guide for caregiver and close contacts. Now, use information from the Department of Health or the Ministry of Health here. Kay di ta gusto mo gamit og source of information na sa kanang mga social media influencers. And I think that ends our our discussion. Thank you so much for listening. And now, as promised, I included in this discussion, with permission of your dean, on how to apply as a nurse, how to immigrate in Canada. Okay? Hindi ko mag-discuss sa United States, kaya wala man ta nang-apply sa United States, Canada man, so Canada itong applyan. So there are 2 applications that you need to do when you want to work and live here in Canada. Dili OFW ni ha, kuha na siya immigration. So number 1, separate ni sila. Everything you learn, unlearn that one. So number 1, is your nursing license. So you have to apply for your nursing license. Your RN, it's either your RN or RPN, asa ka gusto, no? Kung mag-apply kag RN is a separate application, apply kag RPN separate, hindi siya dili siya 2-in-1. Separate application for RN and RPN. Number 2 is apply for immigration. So aron ka makanis Canada, kinahanglan ka ma-immigrate. Aron ka maka-practice, kinahanglan kag license. So dili sila parehas, apply differently. So there are terms nga itong i-discuss, no, nga inyong dapat mahibalaan, no, magibog. So when they say CNO, it is the College of Nurses of Ontario, or otherwise known as the college. Dili ni katso no may what college did you like? I graduated in the College of Nursing in University of whatever. Libog sila. So inanan you use the operational terms. No, CNO is a college for nurses. Something CNO. CNO is like PRC. They give license to nurses. They screen nurses for pre-entry requirements. So it's more or less like PRC, pero for nursing only. No, PRC nga nursing only. IEN, this is us. No, these are the internationally educated nurses. So what are you? An IEN. Kaya man mo eskwela din sa Canada. NNAS, so this is the National Nursing Assessment Service. So this is the service ni initial nimong sila mo tan-aw sa equivalency sa imong educational requirements from the Philippines. CIC is the Citizenship and Immigration Canada. So mo ni imong timan-an nga mga words ni imong timan-an. Bridging, this is taking a course in university to transition from RPN to RN. So colleges offers they call RPN. Universities offer RN. Ang RN dili siya offered sa colleges. They are different. Colleges and universities are different. Okay? RN registered nurse, RPN registered practical nurse. So applying for nursing. So let's start with nursing. So you go to the National Nursing Assessment Service or NNAS website and open an account. NNAS will tell you which documents they need to verify. So they need to verify your identity, nursing education, nursing registration, employment, language proficiency. Okay? And NNAS receives review, store, ensure documents are complete, valid, evaluates education against Canadian education standards, and prepare a report and send it to the College of Nurses of Ontario. The question is, kano sa ako mo-apply sa NNAS? Okay? Kano sa ako mo-apply sa NNAS? After ka makakuha o experience. Most probably, apply 1 to 2 years after ka nakatrabaho o nursing. No, di trabaho call center, katrabaho o nursing. I suggest you work in the Philippines for 2 years. And then, pwede good 6 months. Apply na yun ka sa NNAS. But, yeah, give yourself ample time to serve the Philippines and kanang tawag na, serve the Philippines and, gain experience. So, after 2 years, apply ka sa NNAS. No? So, kano sa ka mo apply, kano sa ka, then, kita mo na ay gitawag, laser. Na gitawag og that's for the employment, no? Employment. Na so mga employment. So una ka mo adto sa NNAS after 2 years ni mong trabaho or 1.5 year. Okay? And then language proficiency. Kani identity pwede passport, driver's license, nursing education sa UC. No, graduate nimo sa UC, mangayo na kani. Nursing registration imo sa PRC. Employment sa imong trabahoan. So, trabaho sa kag 2 years. No? Importante trabaho sa kag 2 years. Pinaki ample time. No? 2 years. So, language proficiency, imong IELTS. So, before ka mo take sa imong IELTS, make sure nga nagtrabaho sa ka. Mo 2 years sa ka. Okay? Kaya ang IELTS ni mo expire in a year or 2. In a year, I believe. Expire. So, take your IELTS close to mga 2 years na ka. Okay? So, once ma-complete na ning duha, create an account in NNAS. Okay? So, in-create ni mong account na anay mga documents, mga paper nga imong i-download. Download to ni mong paper, fill it up para na sa imong nursing education. Ihatag nimo sa UC, sa nursing registration ihatag nimo sa PRC. Okay? O sa imong employment ihatag nimo sa imong gitrabahoan. No? Nya sila na instruction dito nga sila ang mopadala ngadto sa kuan NNAS. Human imong language proficiency imong iingon nga kuan and take ka para sa imong NNAS. Nya sila ra sa mopadala sa NNAS. No? Inana. So naay timing ang imong kuan, imong kanang kuan. Akong gibot sa una, nag-file dugay naman ko nga nurse. So nag-file, nag-open ko, akong gi kuan, gi panghatag tanan. And then I took IELTS. Nya ipasend sa kuan. So it takes time to process this. NNAS receives your stuff, and then once NNAS is complete, you will receive an instruction on how to apply in CNO. Application starts if they receive a request from you to begin a process of applying to register in Ontario, and the fee required to begin the registration process, a report from NNAS. So, ang fee, I think it's 300 plus, hindi ko sure. Once CNO receives the above, they will so dili ikaw mag-send, ang NNAS mo send sa CNO. After na madawat sa CNO, they will review and will inform you if you can take the next generation NCLEX. So make sure you don't lose your NNAS password and account name. Okay? Yato ka mo tanaw dito. Okay? Importante kay na siya. So this is the website for CNO, cno.org. So ag-apply ka sa NNAS, pwede yan sa ka mag-open ng account sa CNO. No? So CNO, log in ka diha, create kag account, log into my account, and then mo pili ka dinhi ka. Don't have an account, click here to register. This is the website for NNAS. So my.nnas.ca. So create an account here. Onya, these are the payments for CNO ni siya. CNO payment ni siya. So sa registered nurse, ang initial application is $339 Canadian dollars. Ang registration exam is $406.8, and the jurisprudence exam is $40. Jurisprudence exam kanang exam dinhi nung kanang kuana mga legal nga ethical legal exams. Okay? Now, applying for immigration in Ontario. Okay, so this is the different application. Nurses are eligible for Express Entry Human Capital Priorities or OINP, Employer Job Offer in Demand Skills. Okay, so Express Entry Human Capital Priorities, pwede ka mo-apply ani. Yung mga employers, marag nakabutan to optional. No? So, pwede rasad, wala. Kung nakay kaila din pwede sila mangitag employer para nimo. Later on, tuluan ta mo how to saan yung magpangita sa inyong employer kung wala may kaila din okay? And then open an account in cic.gc.ca. So the cost to apply is 1,500. So sa man imong i-click, no? Sa man imong i-click, nag-open mo sa CIC, ang imong i-click kay kuan kanang immigrate to Canada. Nya apply aning Express Entry Human Capital or OINP, Employer Job Offer and Demand Skills for Nursing. Okay? Nya, if you're like me, walay kaila, so you go to this, the job bank. So at jobbank.gc.ca. So this is a government website. Kanan akong gisulti sa government website. Okay? Wala tayo kuan din kanang agency. Dini agency. Agency, pangwartahan ka sa agency. Kani bayad sa agency 50,000 assessment. So all you need to do is to read, use your brain. So you go to job bank, ramangita ka og employer, no? So dinhi butan nimo nurses, dinhi Ontario. I-click nimong advance, i-type in nimo kuan employer Trillium Health Partners. This one, Trillium Health Partners. Kung gusto ka mo trabaho sa akong gitrabahoan. Trillium Health Partners, click advance, Trillium Health Partners. Pinan kani mga keywords nurse and in Ontario. And then makita na nimo din ang mga hiring sa Trillium Health Partners. Click this one. Gaman nimo click ana. Dinhi sa email. Okay? Click the email. Musulti din kang, hi, I'm Domino Puson from the Philippines. Attaches my CV. I would like to apply in your institution. I am already approved. My license is approved in CNO and blah 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 blah. Okay? And then, for example, yung NNS, pasara kasi yung NNS. Pasado na ko sa kung NNS, I already have taken NCLEX, mo na. Okay? Nya, human, attached to my CV. And I just need an employer offer to apply for an immigration. So, good luck. Emailan na kanila nga, this is our job offer for you, blah, 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 blah. Imagine na ka sa Canada. Process nito ni immigration. Okay? Now, you got unlucky because the NNAS says ang imuhang kuan, ang imuhang tawagana, ang imuhang application, imuhang education gap is kuan kanang tawagana. Ang education gap kay dili equivalent to their RN here. So, pwede po ka mag-RPN. So, sa imuhang CNO mo apply ka as an RPN. Naduha man apply ng RN or RPN. Akong gi-applyan ang both. Mana RN, RPN ko. So, RPN, kung gusto ka mag-RPN, so, mausab na yung application. No? Pagawa sa NNS, uy, hindi man equivalent ang ako ang education to RN, RPN man. Or sa NNS po, ang yung application, duha, RN o RPN. So, mapod na siya. Kung RPN ka, mas dali ka makasod kaysa RN. RN kaya ka mas lang machuchu. Sa ko RPN. So, dali ka makasod RPN. So, kung RPN ka, yung imuhang safe practice kay kinahanglan ka nga imong safe practice ayo pag-resign ha nag-apply nimo og Canada kay ngano kung resign ka imong safe practice kay ma-expire. So, I think it expires in 2 years or 3 years. So dapat active gihapon ka. Nya mao na nga kung pananglitan ma-expired na imong kuan RPN, pwede ka miskwela ning eskwelahan Humber as an international student. So imong immigration karon dili na to immigrate, ang imuha to study. Mo nang uban mga estudyante mo sa Canada to study. So multi pathway siya no, libog siya gamay. So for example, in NAS, apply kag RN o RPN. Yung imong RPN kay ang ingon sa NAS ng imong RPN kay pwede na ka maka-practice og nursing sa Canada. Unya, dugay man ni pwede na ka maka-apply dayon sa imong immigration nga RPN ka. Okay? Pwede na mangita og job bank. So, panitan, abot ka sa Canada, wakitag trabaho. Nadugay ka, 3 years ka mo, matrawag nursing, na inactive ka, ma-expire, imuhang kuan, imuhang tawag na, safe practice. So, mo na nga magkuan ka, RPN, ani nga kuan, RPN refresher course, ani nga eskwelahan Humber. So, kuan lang ka dito, no? For example, ang imuhang RN, according sa NNAS, dili equivalent tanan na kay mga gaps ilista nila kung sa mga gaps nimo. So mo email ka ani ato kaning website nga ipakita sa continuing education sa St. Francis Xavier University. Unya kuan kanang imos like email nga mao ni ang gap ingon ang CNO. Musuot man ang CNO nimo, mingon na sila nga these are your educational gaps. So mo click nimo siya, email nimo ni sila distance learning. Niya ila kang pangayuan o requirements niya assess nila. Pwede ka na sa Pilipinas while nag-study ani or pwede ka nga na sa Canada na. Okay? And then, this is only for competency gaps sa imong education. Okay, naman tayo mga education courses nga wala sa Pilipinas like nursing in Ontario na din sa Pilipinas. So, wala matada. So, mana siya. Next, this is a university. Okay? Human, for safe practice. Na yung safe practice kay undang mo kag nursing na expired. This is only for expired safe practice. So na expired na adto kay George Brown College. Eskwela ka dito og kuan continuing education sa IENs. This is for your safe practice. Sila na sad bahala nimo nga maka-eskwela ka og kuan. Maka-eskwela ka og kanang tawag ana yun maka consolidation ka or maka-duty ka og hospital kani. This is when, kaning schooling, this is when ang imong NNAS advisory kay dili compatible imong education to nursing education here. Unya, taga-apod ka na lang options. Bago karon na kailang options nga kuan, mo take ka og INCAP. Kanang test na siya to challenge your simulation test to challenge your kuan, to challenge your education challenge your education kung ang imong practice is compatible ba sa nursing. Once you pass NCAP, pwede na kang register as a nurse. Okay? So you can do your application sa immigration and your nursing license at the same time. Okay? So our Canadian Embassy is located in MG Cuenco Avenue. Doon sa napita. O sa Canadian Embassy na sa K-12 building sa Ayala, Samar Loop. Ayala. Dito ko ni-adtuan for my interview sa Canadian Embassy. No? Yeah, I wish you all the best and I hope to see you soon. Here now, my question, please don't hesitate to ask me. And don't be scammed, okay? Thank you for listening. I guess this is the end of my lecture for this week and for the entire semester. My references are the following. Thank you and have a wonderful day.